This last week, Centricare physicians saw an increased number of patients coming in with acute diarrhea, gastroenteritis. It's typically caused by a virus, at least in the United States, and that virus is very easily transmitted from person to person. Norovirus, rotavirus, those are some of the names of the viruses you may have heard of. Again, these are transmitted very easily, and the biggest risk is dehydration from the diarrhea and possibly the nausea and vomiting. Other less common causes are bacterial infections. You may have heard of Salmonella, Shigella. These are foodborne infections, typically causing a lengthy diarrhea and possibly even hospitalization. And then lastly, parasites. We really don't see parasites in the United States unless you are drinking from well water, have been camping, perhaps transmission in a daycare from child to child. So these are the three big reasons for having diarrhea. Another thing to remember is an organism called Clostridium that comes after taking an antibiotic. That can cause some serious complications. So if you have any of these signs, fever, blood in the stool, abdominal pain, severe abdominal pain with your diarrhea, those are indications to get into a doctor and get it checked out.
How to treat diarrhea. Symptoms of diarrhea include frequent loose stools, abdominal cramps, and dehydration, all of which are uncomfortable for you or your children. Because diarrhea is usually not a serious illness, it can easily be treated at home. You will need fluids, clean hands, and a doctor. Step 1. Treat your child's diarrhea at home by increasing fluids that help replace electrolytes, like sports drinks. For babies, offer them additional breast milk or formula. Avoid plain water, fruit juice, and sodas. Step 2. Continue your child on their regular diet. Step 3. Frequently wash your hands and your child's hands. Keep suspected diarrhea-contaminated areas clean. Step 4. Consult a doctor if your child's symptoms do not improve within 24 hours. Call a doctor if your baby has not had a wet diaper in over 3 hours, has a fever higher than 102 degrees Fahrenheit, is unusually sleepy, has a dry mouth, or has bloody or black stools. Step 5. Treat diarrhea in adults by drinking plenty of clear fluids such as water, broths, and gelatins. Avoid coffee, alcohol, and apple and pear juices. Step 6. Gradually add solid and low-fiber foods such as soda crackers, toast, and chicken. Avoid dairy products, high fiber, and fatty foods. Step 7. Consult a doctor if you are an adult and the diarrhea lasts longer than 3 days, you are dehydrated and have had severe rectal or abdominal pain, bloody or black stools, or a temperature above 102 degrees Fahrenheit. Eating the right things, or getting the right advice from the doctor, will have you back to your regular self in no time. Did you know acute diarrhea is commonly caused by consuming food or water contaminated with a viral infection, bacteria, or parasite?